In this presentation, I'm going to give you a basic understanding of cleft lip and palate. Take a moment to brainstorm. Do you have any prior understandings about this topic? So what is it? Let's break it down. A cleft is a split or opening in a structure. The hard palate is the bumpy ridge on the top of your mouth. If you run your tongue over the top of it, you might even feel a line down the center where the two bone arches came together. Therefore, a cleft lip and palate is an opening that runs from the top lip on through the hard palate. Picture A, as shown, is a unilateral cleft lip, as in the cleft only comes through the lip and only slightly to the alveolar ridge in the purple underneath of it. B shows an incomplete cleft palate, so where the cleft is isolated, there is no cleft of the lip. C shows an incomplete unilateral cleft lip and palate. The cleft in the palate and the cleft in the lip do not meet, and it is unilateral because the cleft only happens in one direction. Similarly, D is a complete unilateral cleft lip and palate. The cleft is a complete opening from the lip on through the hard palate. E shows a complete bilateral cleft lip and palate. It is bilateral because the cleft runs in two directions, starting through the lip and on through the hard palate. There is even such a thing as a submucosal cleft palate. This occurs when the palatal bone never fuses together, but the mucous membrane underneath is fully intact. Signs of a submucous cleft palate include hypernasality in the voice, a bifid or split uvula, and if a light is shown into the mouth, a bluish hue can be seen on the roof of the mouth, which would typically shine red. Cleft lip and palate occurs in utero during the 7-week gestation period. There can be a genetic predisposition for cleft palate, but typically the deficit occurs because of certain teratogens introduced by the mother. Teratogens are simply an agent or factor that causes malformations of an embryo. Examples shown here would include drugs, alcohol, or even something as common as a viral illness or infection. Each year in the U.S., over 2,600 babies are born with a cleft palate and more than 4,400 babies are born with a cleft lip. 70% of clefts are isolated, meaning they only occur with no other birth defects. The prevalence rate of orofacial clefts varies by population, but overall, higher rates have been reported in Asians and American Indians, and lower rates have been reported in African-derived populations. What can be done? As soon as the baby is born, the primary concern is feeding. With the opening on the roof of their mouth, the baby isn't able to create the negative pressure necessary to suckle. There are feeding bottles that make an artificial hard palate so the baby can feed without the formula going into the nasal cavity and causing aspiration. Treatment for cleft lip and palate takes time. Cleft lip and palate is not fixed overnight. Once the child is about 1 to 3 weeks, a plastic surgery evaluation is done to consider pre-surgical orthopedics to help minimize the cleft before surgery. At 3 to 6 months, surgery to repair the cleft lip is performed, and only once the child is around 12 months to 18 months will surgery on the actual palate be conducted. Take a moment to think of one last question to ask that you may have had after this presentation. And these are my sources.